We've seen how the recent report by UNICEF and WHO ranked Nigeria among the best 4 countries that have been able to sustain routine immunization despite the pandemic. This gives us a lot of confidence that working with the same template, we'll be focusing on the last mile where it's hard to reach Nigerians because of the terrains that they live in, whether they live in riverine areas, mountainous areas. What this grant from the Canadian government will be doing is giving us a shot in the arm so we can go further and reach more Nigerians with life-saving vaccines and commodities. So we're really excited about what we'll be able to do. When you look at the data, Nigeria did exceptionally well with the vaccination program during COVID-19. It is the same sort of framework we're using, engaging with traditional leaders, religious leaders, community-based organizations, and of course, our very vibrant media to make sure that the right information, the right communication goes out there to Nigerians. We are very watchful of what happens in our communities, and it is because of the relationship that we maintain with the gatekeepers that people are now coming out to receive the vaccines. We are using the platform of COVID-19 vaccination to strengthen routine immunization, but also bearing in mind that where we have low coverage, it is symptomatic of weak health system. So we have to continue our advocacy to the subnational level with the governors to invest more in primary health care, especially in terms of human resources. Only some 27% of primary healthcare centers across the country have the requisite number of human resources. So our advocacy to governors is that they need to recruit manpower that will do the work of not just immunization, but also look at nutrition, look at antenatal care, making sure that when you go to a primary healthcare center, you will get the right kind of quality of care that will ensure that people improve when they come to the primary healthcare center. And for those patients that cannot be managed at the primary healthcare center, that there is a swift and effective referral system to the next level of care, whether that is a general hospital or a tertiary center. We are enthusiastic about the malaria vaccine. Nigeria has now been approved to receive the malaria vaccine. The only challenge, of course, is the global shortage in terms of supply. As more vaccines are produced to be able to cater to the countries with large populations like Nigeria, then we will get the vaccines. But in terms of satisfactory demonstration that we'll be able to administer these vaccines, we have sort of been able to overcome all of the hurdles. When you see that the vaccines are sent to smaller countries with smaller populations, such as Ghana, you know that definitely it is a supply issue. But in terms of capability, Gavi, the Alliance for Vaccines and Immunizations, the World Health Organization have already given Nigeria the pass mark. So all we're waiting for is for the vaccines to come, and then we'll begin to roll them out across the country. So right now we're working with 2 vaccines. There's the RSSH vaccine and then the R21 vaccines. What we're optimistic about is that we have the opportunity of actually delivering either vaccines. As long as the vaccines are available, then we'll be able to get it to every part of Nigeria, every nook and cranny of Nigeria, just like we did with COVID-19 vaccination, just like we did with polio vaccines. We will be working with all of our stakeholders, the subnational level, to make sure that we deliver these vaccines to all the Nigerians that need to be vaccinated.
Executive Director very eloquently outlined the importance of the announcement today. But I'd just like to add from the Canadian perspective, I think it is another example, a tangible example of where good partnership can make a tremendous difference in the lives of Nigerians. And, you know, through Canada, through the Government of Canada, and our partnership with the WHO, where we have very good working relationship here in Nigeria and around the world, and as well working with the Nigerian Ministry of Health, I think we're able to bring some very important change to this particular issue. And so on behalf of the Government of Canada, it was with great pride today that we launched CanGive. And I would like to thank the Nigerian Ministry of Health, the Executive Director, and others for all the work that they do in bringing important changes to the healthcare system and to challenges that exist and can be overcome through good partnership.
Optimistic because it's coming at a time where Nigeria has shown potential in some of the states to really upscale the COVID-19 vaccination and also strengthen surveillance and outbreak response. So we were the last 2 days in Jigawa, for instance, and we saw that it's doable. So we can replicate that experience to the other 15 states to catch up. As I mentioned before, it's very important. It's now time to reach those that we couldn't reach, those that are partially vaccinated, but those are also zero dose vaccinated. So we need to reach out to them, because if we are to achieve herd immunity as a country, we really need to get to all those who are in need for services. So I think there is many reasons to be optimistic.